webinar, I just wanted to tell that I'm here to explain the concept of exercise prescription using length tension relationship. I'm not giving any marks based question and answer session is not going on here. So please try to understand the concept first. If there are any further doubts regarding whatever has been done, that can be discussed later. So let us start. So exercise prescription using length tension relationship. What is length tension relationship and why are we learning about exercise prescription? So exercise prescription is something that is exercise therapy based. Length tension relationship is biomechanics based. So I am trying to combine two subjects in one webinar here. So generally, as a whole and soul physiotherapist, once you are out of your graduation or post graduation, you will not see any patient like biomechanics patient or exercise therapy patient. You need to uh, summarize all the things you have learned in anatomy, physiology, biomechanics, exercise therapy, and club it in one. And then you will be able to justify what you have learned all this 4.5 years plus 2. Here, earlier I took this the other webinar, exercise prescription using lever system. So the students who have joined that, here it is the exercise prescription using lever system. There, I have given you a few examples which you can relate to the daily living and thereby prescribing the exercises to the patients depending on their need and your goal as well. So let us get into the webinar. First is force production in the muscle. So whenever a patient comes to you or you are prescribing some exercise to any athlete or any beneficiary person. So first comes here force production. So what is force? Any pull or push on an object is considered as force. Now, my muscle, for example, biceps. If I am talking about my biceps, it is starting from the shoulder, ending on the elbow. Roughly speaking about the origin and insertion. Here, whenever I talk about a muscle, I'm talking a muscle in whole. I'm not talking about one sarcomere or one myofibril or a muscle fiber here. I'm talking about the entire muscle bulk. But this entire muscle bulk is made up of all the muscle fibers in which sarcomere is there. And from there, from the microscopic structure of the sarcomere, we'll be learning how the force production can be varied. So there are three main factors of force production in the muscle. So the first coming length tension relationship, about which we will be talking today. The second one is load velocity relationship. And the third one is force time relationship. So length tension, it is very clear the length of the sarcomere. At that particular length, how much tension is there in that particular muscle fibril or sarcomere is what we have to be considering. Now, coming to the length tension relationship. So length tension relationship here is basically a primary evidence supporting sliding filament theory of muscle contraction. So sliding filament theory, which we learned in physiology, is again a same theory. 90% people believe that this is what exactly happened in the muscle. But there are still 10% scientists telling there will be something else happening in my muscle. So before going in details, this is the sliding filament theory. So this is my actin, this is my myosin. Myosin head attaches to the actin, and once cross bridge is formed, it goes for power stroke. After power stroke, my actin will be moving closer. So actin myosin head getting attached. Once this is done, myosin head goes for cross bridge formation and then power stroke. Then comes the recovery stroke. So recovery stroke requires ATP, not the power stroke. So here in the all the four stages, so you can see my cursor here. One second. So the troponin, tropomyosin, and the calcium binding site of the actin, the myosin head here, this myosin head goes and goes at the actin site, gets attached, and once it is attached, here the cross bridge is formed. Once the cross bridge is formed, power stroke happens from where from point A, the actin is moving to point B. This is nothing but two filaments in the sarcomere are sliding against each other. Hence the name sliding filament theory. So in the earlier slide, I have mentioned length tension relationship is basically primary evidence of how the muscle contraction is happening. So as we all know till now, muscle contraction, three different: dynamic, isometric. I'm so sorry. Here I'm talking about eccentric contraction, concentric contraction, and isometric contraction. So here in sliding filament theory, in this basic muscle contraction, isometric is the length is same. The length is not changing. For example, this is my sarcomere length. This amount of sarcomere length is fixed. This is same in the isometric contraction. In concentric, they go closer. In eccentric, they go more away from each other. Not I'm not here. Here I'm not talking about the stretch. Here only I'm talking about eccentric contraction. Next, the relationship of this, the length and tension here was first determined in isolated single muscle fiber. So whenever I'm talking about length tension relationship, depending on the evidence, I'm talking only about one single fiber. I'm not talking about the entire muscle. So the exercise prescription using length tension relationship is having a twist at the end. Let us see what is it at the later. But now I want you people to remember that length tension relationship concept here, what I am talking about is completely about a single muscle fiber. It's not about the entire whole muscle. Now, coming to the first image, here the length of the sarcomere. There are the thin filaments, actin, thick filaments, myosin. So the second image here represents how the muscle is there in concentric contraction. This comes in eccentric contraction. This is the resting stage. So I am sitting now. Let's say my trapezius. My trapezius is holding my head. There is no movement in the head. My trapezius is just doing the stabilization activity here. So all the myofibrils in my trapezius, upper trapezius, are now considered to be in resting phase. So whenever they are in resting phase, the distance between two Z discs is this much. Now, if I do shrug, if I do this particular movement, then it goes for concentric contraction. That means two edges of the muscle are trying to come closer. Me, after sitting something around like half an hour in the same position, I try to just do the stretch. So whenever I do this, I am going for a position where it is lengthened more than the eccentric contraction. So what will be eccentric contraction here? When this same side lateral flexion I'm talking about here is concentric contraction, coming back to neutral and going back to a position where tension is still maintained. That is considered as lengthened position or eccentric position. Now, what is optimal sarcomere length? A small example I would like to give here is whenever you get an injury of your elbow, either it might be a fracture or a sprain or something. What happens here is you tend to go for 90 degrees of elbow flexion and completely medially rotated shoulder and adducted shoulder. Any injury in the hand, right from the wrist till your shoulder, unknowingly, even a non-physio or a non-medico tends to keep his hand in this way. Adducted and medially rotated shoulder and flexed elbow. So why this happens? So first reason is joint position. This is the loose back position for elbow. Hence, whatever swelling or inflammation is there, that tends to be carried away like that. Now, coming to, I'm sorry. Now coming to the optimal muscle length. Whenever you rest, I'm telling whenever you rest, like let me first say, like you're standing. Standing is a starting position. You're not doing any activity there. So whenever you're standing, the muscles they tend to stabilize and mobilize at few particular joints and not at every joint. So again, the same example of trapezius. The trapezius then is in its optimal length, resting length. Now, there is a slight difference between resting length and optimal length, which I'll be explaining later. Whereas here, you can see the next point, muscle fibers develop maximum isometric tension at optimal sarcomere length because thick and thin filaments are positioned so that the maximum number of cross bridges within the sarcomere can be formed. Coming back again to the length tension sliding filament theory. Here, this is one myosin head. Imagine there is one more myosin head here. Imagine there is one more myosin head here. And on and overall, my myosin is having 10 heads. Actin is having 10 free sites. So 10 on 10, demand is equals to supply. Now what happens? This is actin, this is myosin. Now what happens is whenever the cross bridge is formed, the cross bridge is forming, power stroke is happening, myosin is moving. Again, recovery stroke, my cross bridge forms, power stroke forms, the myosin again moves. Or it's basically kind of like myosin will be pulling actin towards the center line. This particular movement happens in one particular muscle fiber. So now, okay. Imagine there is a classroom of 10 different benches and there are 10 students. So first 10 students are coming. They are occupying all the 10 seats. This is fine. So this is basically what it happens in same cross bridge formation and all. So there is a free site. Myosin is there. Myosin is going and taking over that free site. Cross bridges form. Power stroke and then the recovery stroke. That is how actin is pulled towards the center line. Now, at what particular distance or at what particular length of the sarcomere, I can say that the sarcomere is having the peak tension, the highest tension of all. So, a small activity for you people, if it is possible, just try to have a 1 liter water bottle or any particular weight and 3 different ranges. This we are doing this experiment for completely biceps. This will be the inner range. This will be the middle range, and this will be the outer range. So I want you people to take any weight. Either it might be book, even Kistner can be considered as weight here. Take Kistner or any bottle or a dumbbell if possible, and I want you people to hold here in the inner range. Next, once this is done, try to hold it for 30 seconds. Once this 30 seconds is done, we'll be going for middle range. So again, hold it for 30 seconds. So once this is done, outer range. And I want you people to comment on which range you are feeling too much force or too much pressure on your muscle. So any answers? Okay, coming back again to the experiment and the result. So here what happens is, this is considered as the extreme range. This is considered as extreme range. This is considered as the middle range here, where you will be feeling some amount of tension in that particular muscle. Now, earlier, before starting the webinar, I told you people that here, whenever I'm talking about length tension relationship, I will be talking about a single muscle fiber. I'll be not talking about the entire whole muscle. But here I just gave the example of biceps in 3 different ranges. So what I did here is, here I'm trying to explain you people how the loading will be working. So when you can't feel the tension, when maybe you might not be doing any particular exercise till now. So when you don't feel how the tension works, you can't relate how length works. So it's like vice versa. If length is increasing, there is no need that tension should increase. And if tension is increasing, there is no need that length should change. Mostly, this length tension relationship concept works in isometric isometric exercises. So muscle fibers develop maximum isometric tension at optimal sarcomere length because thick and thin filaments are positioned so that maximum number of cross bridges within sarcomere can be formed. One more example I'll be giving here just to correlate how the cross bridge formation and how length tension relationship works is, for example, your exam dates have been announced and the exam dates are something around like 30 days. 30 days is very huge time, very long time, and I can do miracles. So there'll be like almost 100% of the students thinking 30 days, 30 units, set. I can completely cover all the syllabus and even revision can be completed. Now, after 30 days, in the starting, most of the people will be thinking they'll not do actual work over there. So days will be passing. Now, the time comes where I'll be doing like 15 days will be there, but 30 units are still there. So 15 days, 30 units, there are still students who keep on thinking like, chalo, I can complete like 2 units in one day and still I'll be having time for syllabus. Revision completion. Now comes single day batting students. So most of the students tell that they do single day batting, but most of the students tend to go for second option. Like they'll be reading now or then, but they'll never tell their friends or anyone that they started their preparation and all. So single day batting is kind of like extreme situation or extreme position. The same thing, the same word extreme position I am using for the first like 30 days and 30 units example. So the middle one, 15 days, but 30 units, whatever are left over, is considered like optimal time, kind of like safe period. So in this safe period, there are chances more chances, high chances, the student who started like their preparation something around 12 days to 15 days will be scoring very good marks or maybe even distinction at that particular area. But single day batting, mostly they tend to go for like pass marks. If I clear this exam, that is much enough for me, that rather than me scoring distinction and all. It's okay, it's up to the students' mentality here. I'm giving this example here because when I'm having ample time or whenever I'm having too many free sites, my myosin will be thinking that if I am not doing it, some other myosin head might be doing it. And that is what happens in the length end position. So just keep your elbows straight. So whenever your elbows are straight, what happens here is the muscle is in lengthened position. The sarcomere is in lengthened position. So whenever the sarcomere is in lengthened position or the muscle is in lengthened position, there are zero cross bridges formed. So zero cross bridges form, zero tension present. Now comes like from this lengthened position, now my muscle is trying to build some amount of tension by reducing length. How the length is reduced? By cross bridge formation. So when there are like hundreds of seats and only 2 to 3 people present, there is no clashes between like I'll be sitting there only or I'll be sitting under the fan. No, those clashes you won't be seeing if there are hundreds of chairs and only 1 or 2 people coming to sit. But you will definitely see this clash or kind of tension when there are hundreds of chairs but only 50 people are coming. Even though there is 50 people coming, you will be still seeing that specific selection of the chairs. I'll be sitting in front of the teacher, or I want to be a backbencher today. I will be sitting back. So this all continues, and selection of chairs will be primary criteria there. But if there are 100 chairs, but 110 students, there is no selection criteria. Only you will be lucky if you are able to sit or at least stand in that particular classroom. So this is what happens in entire sarcomere. When the length is this much, when the length of sarcomere has reduced, that means the cross bridges are already formed. The cross bridges, the actin sites are already too much populated. There is no area or there is no place for the myosin to enter. So whenever this is happening, when there is no place for the myosin to enter, what happens? The tension is reached plateau, that is highest of the tension that should be reached. Hence, the tension will be reduced completely. Now, if the muscle is relaxing, my muscle is tending to relax now, and the length increased slightly. So, whenever the length is increasing slightly, the overpopulated area is kind of getting reduced now. There are few free actin sites and few myosin heads which are free, which are not connected. So when this is happening, there is 100% possibility that the length will again reduce. So 100% possibility that the tension will again increase a bit, but again fall down. Now, after relaxing, this I am talking about resting phase completely. Or now my muscle is lengthened. So whenever the sarcomere is lengthened here, what is happening now? There are zero cross bridges formed. So no cross bridges formed, no tension there. Let us go for the next slide here. If muscle fiber is lengthened or shortened beyond optimal length, amount of active tension that muscle fiber is able to generate, the when stimulated decreases. I'll come back to this point again. Here there is a slight confusion you will be getting between optimal sarcomere length and resting sarcomere length. So theoretically, so I can't go to each and every patient and tell that 2.30 to 2.47 micro units or micrometers is the optimal sarcomere length of your so and so muscle. This is theoretical reading completely. So resting will be something less than this. So something around 2 to 2.05 micro units might be the resting sarcomere length. So optimal sarcomere length is slight bit high than the resting sarcomere length. We'll get back to the previous point once I'm done with the graph. So this is the basic length tension relationship of a muscle. So here you are seeing a ascending limb, a plateau, and a descending limb. Ascending limb, a plateau, and a descending limb. Now coming back to tension. So most of the students will be used to the word sarcomere length but not sarcomere tension. So here what exactly sarcomere tension or the tension of a muscle is. If my muscle is not having this particular character tension, what happens is there is no musculoskeletal system without this tone or muscle tension, because in the optimal sarcomere length, I just told there are few cross bridges that should be formed. So if the bridge is not formed, nothing but my muscle is in completely elongated phase. So whenever my muscle is in completely elongated phase and no cross bridges are forming, there is some energy that is still keeping the actin and myosin together. Yes, there are different proteins that keep actin and myosin together. But to avoid complete collapse, what happens to avoid complete collapse here? My muscle will be creating some amount of energy stored, which is stored as potential energy. No movement is done, energy is stored as potential energy. If you are doing any movement, energy is converted as kinetic energy. The same law which we learned in chemistry. Energy is neither created nor destroyed. It is just converted from one form to other. So whenever you are doing some activity or you are nodding or you are moving your head, the energy just doesn't comes like that. Whatever energy, the stored form of energy is nothing but muscle tension. So there are two types of tensions here, active tension and passive tension. Go with the name again, active tension, it requires some amount of energy. So if it is requiring some amount of energy, then that is coming from the structures which actually use energy. Structures using energy here are actin and myosin. Whereas coming to passive tension, tension in non-contractile elements. So here in non-contractile elements, completely about the elastic components. Now, this active tension in a muscle is initiated by cross-bridge formation. If cross-bridge formation is there, then there is active tension. If cross-bridge formation is not there, there is still some amount of tension in the muscle created by lengthening of muscle beyond the slack. So what is slack? Slack is nothing but extra, something extra. So for example, I hope you people are able to see my sleeve. So this is my forearm. This is my sleeve. This is nothing but slack. Or for easier understanding, whenever we get new clothes, most of the people will be either choosing a size which is fit for them, not tight, which is fit for them, or one size extra, just in case what if I gain weight. So what happens, there will be some extra stitches on the inner side of the kurti or any dress. So this is nothing but slack. So this extra thing in the muscle is nothing but the elastic components. So imagine, yeah, you are able to see my hand here. This, imagine my hand is a sarcomere now. This is nothing but a slack. Yes. So, for example, this is my tendon over here. Muscle is starting. Aponeurosis or any junction, myotendinous junction there. So, whenever there should be some amount of movement to be done, slack is released. Nothing but passive tension is released and the energy is moved away or energy is given for the active tension to carry on. So slack is something which is like extra fitting or extra cover that is present around the muscle just to create more space so that more energy can be stored. This is nothing but passive tension. So active tension is created when cross bridges are formed. That means whenever the muscle is in lengthened position, there are no cross bridges formed. Yet there is some amount of tension present that is created by the passive tension, created by lengthening the muscle beyond the slack. This is nothing but tension, both active tension and passive tension, which we'll be seeing in the muscle. So now coming back again to the graph, this is the starting point where the tension is 0, 20, 40, 60, 80 and 100. Okay, here the tension builds up. So if the tension is building, that means cross bridges are forming. So this is the peak. Earlier I just told you now that whenever optimal sarcomere length has been reached, that means the tension is peak at there. So this is peak. Once it is reached, it tries to stay for some time. Nothing, it is basically considered completely as a plateau. And again, when lengthening, the active tension is reducing. So whenever the active tension reduces, the passive tension comes in play. So the tension is reducing. So as the sarcomere length is increasing, first the tension increases, then a plateau, then tension decreases. This is nothing but length-tension relationship. Now coming to the actual length-tension relationship graph. So few people, I have seen few students just getting stuck seeing this graph. There's no problem in the graph here. Only thing, they might seem or find it more complex than usual. So for those students, I will be telling first go for this graph where it is easier to understand. Now coming back to this. So again, tension starting at 0. From 0, it is peaking up to 100. Once you can see the graph here, it is not straight. It is not a linear line. It is a slanting line. So whenever there is a slanting line, it means the tension is increasing slowly. So once the tension is increased, after shortening, there is a period where optimal length is reached. So once optimal length is reached here, from this point till here, I will be considering it as optimal length only. There is a plateau, like even the tension is saying I'm full, I don't want more tension now. Once this is reached, here you can see because of cross bridge formation reduced, as the length increases, the cross bridge formation also reduces. Hence, the active tension is coming, but there is still tension. That tension is coming because of passive tension. That tension here is coming because of passive tension, nothing but non-elastic components. So this is about length tension relationship alone. I have not started the exercise prescription part yet. So if you people are okay, we can go, or just tell me if I need to take a quick summary till now. Till then, I'll be just telling about this image. Too much overlap in the cross bridges, no force production at all. No overlap, no force production at all. So whenever there is either like extremes, there is this word which we generally use in Telugu, ativrushti and anavrushti. So this is considered as ativrushti and this is anavrushti. Nothing, then there is no force production at all. If there is something, there is too much crowd or too much populated area, then I will be definitely there is no force production. It reaches the optimal level and then again reduces. The center one is optimal overlap and force production. So there is still place for the cross bridges to form, yet there is a peak tension that is available. So I think the students listening here are too keen. They don't need a revision now. We'll be going back to exercise prescription again. Yes, there is one more slide here. This length tension relationship was determined with isometric contractions in mind. So coming back to exercise prescription here, I just told you there is a twist at the end, that exercise prescription with length tension relationship is just 1/3 of the exercise prescription which you will be giving. There are overall 3 different factors which describe the force of the muscle. The first factor here is length tension relationship. So me telling exercise prescription using length tension relationship and the complete exercise prescription using only length tension relationship is not correct, because there are other factors to be considered, but for force production only there are 3 different factors. So if everything goes well and good, maybe we'll have other webinar where I can go for exercise prescription series on and on. This length tension relationship is determined completely for isometric contraction. Why am I telling this point? What is optimal length? Optimal length is nothing but a length just more than the resting length. This concept is for isometric contraction only. So imagine, forget about this muscle fiber and muscle thing. And now I'm asking a patient to go for resisted elbow flexion. So yeah, resisted elbow flexion. So once the patient has reached its optimal length or the resting length. Okay, I'll be using the word optimal length here. So once optimal length is reached, what happens? The length tension relationship concept. In this length, the tension is peaked. After that, I'm trying to move, the length differs, the tension also differs. So here in the entire graph, we are talking about optimal length where tension is peaked. Then how can I give a statement that this length tension relationship is working for dynamic contractions? Nothing but concentric and eccentric as well. Now, see, the sarcomere length changes during dynamic contractions that affect tension that can be developed in a muscle. Hence, length tension relationship, whenever you're thinking about it, concising your ability only for isometric 90% of the times will actually give you good results than trying to implicate this length tension relationship in all the aspects. So there is definitely, I'm not saying that any patient is coming to you, use length tension relationship and only go for isometric contractions. No, but most of the patients will need isometric contractions more than dynamic contractions, especially patients like me. I'll be telling it when it is required in further slides. Therefore, the length tension relationship should be considered with force velocity relationship in dynamic contraction. Now, this application, whatever application till now and whatever statement I just gave, that length tension relationship is applicable only for isometric contraction or not for dynamic contraction. Even this application, sometimes it gets difficult or clumsy. Why? Here, from the starting, I have been kept on saying again and again that this entire concept was experimented isometrically and titanically on only one muscle fiber, not on the entire muscle. So, from here till the insertion of biceps, from the origin till insertion of the biceps, there are millions of sarcomeres. And there is no rule that sarcomere in biceps everywhere. For example, if I'm taking bicep from smear from here and here, there is no necessity that both the sarcomeres should be of equal length. No, the sarcomere here might be bigger comparatively to here. What does that mean? That means the optimal length of a sarcomere here is very much different than optimal length of sarcomere here. So if this and this is different, how can I apply on a patient? Let us see that. Application of length tension relationship isn't same and not at all easy because sarcomere length isn't same throughout. For any particular given point, whole muscle length at a particular joint position, there may be sarcomeres at many different lengths corresponding to different points on length tension relationship. The same thing with your hair also, even if it is for males or females. Even if you trim your hair, even if you cut your hair, there is no necessity that all the hair strands should be of equal length, equal thickness, and all. The same concept for the muscle. There is not nothing too much to worry about this. It's basically like if I stop my webinar here saying this length tension relationship was determined only with isometric contraction. I can say most of you people will go tomorrow and chalo, madam told this and I want you to do isometric exercises only. So what are isometric exercises here? So till now you might be just doing isometric exercises that are kind of resisted exercises. Like you'll ask the patient to do and stop. Push, stop, push, stop. Yes, definitely they will be helpful. But your goal you are not achieving here. This confusion is very much necessary here that all the sarcomere lengths are not same. Hence, the application here should change. How? When muscle is acting at a joint. The last webinar, we talked about torque, moment arm. So just like 30 seconds revision. Torque is nothing but whenever two parallel forces are working on a same object around the fulcrum, then it creates a rotational force. Nothing but how I open a tap or how I open a bottle cap. What is moment arm? The distance from the joint axis till the muscle arm is nothing but, from the joint axis till its projection line is, I can consider that as moment arm. So there is a point which we mentioned in the previous webinar that when muscle is acting at joint top, produced is combination, I'm so sorry, that at certain joint angle, muscle length may be short, force will be also. Yeah. At a certain joint angle, muscle length may be short, force will be also short along, but movement arm is long. So once the muscle length is short or the perpendicular distance is whatever the perpendicular distance is there, that is considered. In few muscles, the muscle length will be short. In few muscles, the torque production is small. So here I need to consider both the points again if I'm talking about length tension relationship alone. So for example, if I'm talking about biceps, so there are few trainers who say that once you give some weight and ask the patient to do elbow flexion, most of the people in the gym, they do as if they that is the end task of their life. They hold the dumbbell and know where the load is going onto the bicep. They'll be moving their back or they'll be moving their neck. There won't be any stability, there won't be any starting position or warm up or anything. And their only target is my trainer told me to lift this and do this. I'll be doing this. So this continues till he or she will be injuring their particular biceps. So injury here, that doesn't mean the injury should be shown. Even the micro trauma is considered as injury here. Therefore, there is a necessity that I have to maintain the torque. One conclusion here is muscle is having diminished ability to produce or maintain isometric tension at extremes of joint motion. This is the reason why I have asked you people to do that small experiment that hold weight here, and here. So here the isometric hold is very much high. Here the isometric hold, even this is isometric exercise. What is isometric exercise? Tension should be increasing, but the length is same. So here, once I fix at this particular point, the length is same, but the tension is increasing. Same here, the tension is increasing. Same here, the tension is increasing. But you people generally, whoever take the weight and be in this particular position, in this particular length, not at the extremes of the joint, but only in this particular length, you will be seeing too much of activity developing in the muscle rather than here and here. Why? Because it is difficult at the extremes of the joint because torque production is zero there. At the extremes of the joint, torque production is zero. Hence, ability to maintain the tension is also zero. Now, coming to exercise prescription, I have not included the entire ocean of all the sets of exercises, but only strengthening and stretching here. Because learning something without confusion will be much better. If I add here sports specific training, rehab and all, it will be quite of like more confusion. Hence, in strengthening exercises, here I have written start with optimal range. I'm taking too many biceps examples, so let me talk about triceps now. Most of you might have seen this or known about this exercise. Here, basically, I'm doing elbow extension against gravity. So, elbow extension against gravity, triceps is the muscle here. Start with optimal range. So, start with optimal range. Here you can see whenever people do triceps, skull crushers, overhead extension, no one will be starting the exercise here. This is my starting point, extreme point. No one will be starting here because after taking this arc gets even more difficult. And to just know whether you are doing the exercise correctly or not, at least for beginning starting days, you unknowingly will be lifting the weight from this position, not from this. So this is optimal position, choosing optimal position from this and coming back here at the end. I'm not going completely straight. I'm trying to maintain here. Why? Again, this is extreme. This is extreme and this is also extreme. So most of the exercises, it will be safer for both for you and the patients that start in the mid-range from here till here. One main advantage with this is you will be able to know what your form is and how to correct. So here correction is much difficult. Here correction is much difficult. Here correction is easier. So hence mostly starting and ending or keeping only the optimal range will be more useful, and like me using very less amount of energy, I can give more output. Next is adjust ROM. So adjust ROM I have just completed by saying that there is no need for me to start or like when my trainer is saying I need to do 10 bicep curls, that doesn't mean I need to go throughout the ROM for completing it. Maybe just this much because this is less painful for me, or because this is giving me more power while doing this, maybe I'll adjust ROM accordingly. Next, coming to vary angles. So I'll be giving few names of the exercises here. Bicep curls, barbell curls, incline curls. These three exercises are like 100%, I can say they are only for biceps. But why there are different names? First thing, bicep curls. When I say bicep curls, that means I can do with any of the equipment. I can be doing with TheraBand, I can be doing with dumbbell, I can be doing with barbell as well. So in bicep curls, holding a dumbbell, doing this is done. Same with barbell curls also. Only difference will be I can't swim. I can't stop in between if I'm using barbell. Now coming to incline curls. So incline curls, madam, we have heard about incline bench press, decline bench press. incline curls is nothing but you will be completely sitting, rest. I'm sorry, resting your back, and your arm will be away from the body. Earlier, my biceps, when I'm doing biceps, my shoulder is adducted. Now my shoulder won't be adducted. It will be away from the body, and I'll be trying to sit with my back completely relaxed and then go for curls. This is nothing but varying angles. So what happens with this? So what happens with varying angles? Different types of sarcomere hit at different angles. Now coming to isometric hold. So isometric hold is nothing but we already did the experiment now, like holding the same weight at different angles just to see where it is working. So my advice to you people is, if any patient is coming to you and his or her target is strengthening, complete strengthening, first go with isometric exercises only. You're not getting any exercise, don't worry, take the weight, ask the patient to hold it. Like holding, okay. Take a dumbbell, ask the patient to do front raises and hold. Just keep in this position. So this is also isometric hold. This is also isometric hold. Going down, this is also isometric hold. So what happens with this? You are deciding which is optimal length for that particular muscle. So once you have decided that, you can work more customized kind of thing with the patient here. Next is progressive overload. So progressive overload, we all know. In second year, you will be you are having entire chapter of progressive resisted exercises where you will be learning different kinds of protocols, how to inculcate that with this length tension relationship. Again, isometric hold. Once you mastered this isometric hold, when to give what kind of weight or what amount of weight for what kind of patient. Once this is done, you can easily go for progressive overload. So once that is done, next comes functional movements. So what are functional movements? Okay, there is a patient, a housewife aged 52 years is coming to you and her problem is shoulder pain. I'm not talking about frozen shoulder here. There is some disturbance in her shoulder. And you are asking her to do bicep curls. Okay, she is doing her bicep curls. After 10 days, she has improved, but her main target is she able to cook or she able to lift something. So definitely you will be not teaching cooking in the gym or in your clinic. What can be done? There is something called combination of movements. There is scapula for a reason. There is glenohumeral joint for a reason. There is SC joint, AC joint for a reason. You need to add all those and then create a movement like whatever it might be. It might be simple circumduction. This circumduction can be done in 10 different ways, and this circumduction for that particular patient might be much useful than simple bicep curls. Here I am given just an example of shoulder, but you can actually inculcate this in any particular joint. Next, the last thing, feedback and correction. This is most important thing, because whenever you go to the patient and say, madam, you are doing the exercise wrong. No, I'm doing correctly. Ma'am, you're doing exercise wrong. I'm just seeing it. No, this just happened once or twice. Maybe I'm much cautious in front of you and all. For these patients, I would advise you just a mirror or record a video and show it to them. So there's a saying, action speaks more than words. It actually speaks more than words here, and the patient from next time at least will start listening to you. Next, coming to stretching exercises. So again, warm up, gradual progression, hold in optimal range. Here, warm up, we all know why it is necessary. Coming to gradual progression, you will be seeing people with some tightness, and this very same day, physio will be coming, ask the patient to do this and hold the two elbows, chalo, done, pec stretch. Now again, this goes lat stretch. But have you checked the flexibility of that particular patient? if you are doing this mistake, you might be the reason for his or her tears, particular muscle tears. So what happens? I am keeping my hand here because my therapist have asked. My complete trust is on the therapist. But this is my affected, this is my unaffected. Maybe the unaffected side, my muscle length is also same as the affected side. And the stretching is causing me more and more pain than relief that should be causing. Hence, gradual progression is necessary, even though if it is self stretch as well, even though you're doing it on yourself. Me doing trapezius stretch at this point, for me, because of the spasm and all, this is only the highest. So if I try to do more, what happens? For now, I'll be like, okay, I have overcome one obstacle. No, here I'm creating more and more spasm. The spasm cycle, pain cycle continues again and again. So whenever this is continuing, there is micro tears happening in the muscle or myofibrils. So again, the optimal muscle length will be again disturbed here as well. Next, hold an optimal range. So I'm telling, like, do trapezius stretch. Once this is done, hold it. Most of them will be holding it here because I am asking them to hold it here. Hold it when you feel the stretch over the trapezius. So once you feel the stretch, stop. Once you feel comfortable with this particular range, then hold it for like something around 10 to 12 counts and then increase. This is nothing but hold in optimal range and gradual progression. So instead of going from this position to directly here, you can actually choose from going to from here to here first and then here. Next, active stretching. I would like to share one small experience here. So I have actually written the word active stretching here because of two reasons. During my internship, I was completely like touching patients, treating patients. It was kind of giving me too much of josh. So something in one of my duties, there was a patient with knee injury, total knee replacement. So I was asked the patient to take care of the patient. So I was teaching him isometrics. Any TKR or any post-surgical case, first we go with the static quads. So in that excitement, I asked the patient to just press the knee down. He was doing it, but he was not able to hold. So for that one day, what I was doing is press the knee and I was counting for him like 1, 2, 3, and 10. I did that for 10 different repetitions. The patient was completely happy, but next day, because of some reason, I didn't went or maybe I was ill, I don't remember. My friend took over the case. And I received a call from her and she was yelling at me. She was yelling at me because the patient was showing tantrums that my friend is not counting numbers, hence she is not doing good physio. Hence, please don't assist patients till an extent that they think that is also physiotherapy. That was my first and last mistake in that particular case, where from then on, I hardly count numbers for very few patients because that was like mark in my mind. Okay, if I count numbers today, I have to count numbers tomorrow also. No, I have to not do that. So this is what is happening in almost all physio clinics today. So you go teach them the exercise, but the patient will feel that some manual or some manual technique, machines, or any passive technique, like even stretching also, even the simple stretch of trapezius, they feel that the therapist should do and it is not their work. If you teach them exercises also, they feel that this is not our work. Tomorrow I'll go again, my therapist will be doing something. Either he'll be doing some manual thing or he will be keeping some machine and my pain will be gone. So this to stop this thing, I have exclusively written the word active stretching. We are physios who do manual therapy exercise therapy, electrotherapy, and all. That doesn't mean we give entire our energy on only one particular patient. Next comes individualization. So here again, individualization, nothing but specific, being specific. So if the patient's target here is being flexible, that doesn't mean you giving passive stretches or you asking the patient to stretch at an extent where he or she is not able to do it. That is not considered as specific exercise prescription. Hence, you need to go according to the will of the patient first. Will of the patient here is just be clear. Okay, these are my targets. If you are okay with it, then only we will be continuing. Or else by there itself. Next comes dynamic stretching. Here also I have written again feedback and correction. Feedback and correction in stretching exercises only because the stretch is felt, that doesn't mean all the stretching exercises what the patients are doing are correct. Now, yes, this is plank. Remember the title, exercise prescription using length tension relationship. So once I tell like isometric exercise, the first exercise that strikes my mind is plank only. This is to be more precise, forearm plank. Here you can see the highlighted muscles, the ab muscles, glutes, ilios vas, tensor fasciae lata, and deltoid. Here, even the tibialis anterior, calf, hamstrings, erector spinae muscles, extensors of neck, flexors of neck, almost every muscle will be activated. And how all the activation is done in isometric thing only. No dynamic exercise. The muscle is staying there. The length is being same. The tension is being increased. So at the end, what is my target? My tension should increase. How I am increasing? That is my headache. How I am increasing here? Using isometric exercises. There is one more exercise, wall sit, wall chair. So here you can see quads, hams, and even the calf. So one good thing in isometric exercises, there is no need for you to remember which is agonist, which is antagonist, which is synergist. So any particular position, if my hip is going in flexion, like 90 degrees flexion, that means it is both the agonist and antagonist are trying to maintain balance, nothing but isometric contraction. So the second main advantage of isometric exercises here is the length of quadriceps, the length of hamstrings, both are same. Here, yeah, one more thing I would like to add is quadriceps, hamstrings are not one joint muscles, they are two joint muscles. So there is one more concept, insufficiency, active insufficiency and passive insufficiency. Let's not dig there today in this webinar because it is something bit huge which can't be included in this webinar. Here, whatever concept we have come till now, length tension relationship, optimal length, exercise prescription, using only isometric exercises. Here, forget uh, about whether the muscle is two joint muscle or one joint muscle. Your target is go for like shoulder. If I'm talking about isometric exercise here, even this, okay, I'll talk about my wrist here. This is wrist flexion. So here in this position, also it is isometric exercise. Here also it is isometric exercise. So whatever range you are choosing, the wall sit here, it is 90-90. But if I ask the patient to go more deeper, to reduce this height even more, then there depends that quadriceps is increasing its length, whereas hamstrings is reducing its length. So again, if length is increasing, first tension decreases. If length is decreasing, first tension increases, but again it decreases. This is dead hang. Hanging is also one of the starting positions which we learn in exercise therapy. Latissimus dorsi, all the postural muscles here, rhomboids, middle trapezius, levator scapulae, and the forearm muscles and the arm muscles. All muscles here will be included in these exercises. I have added the pictures of these three exercises, not the other. Here, isometric exercise don't go just isometric exercise means body weight exercise only. No, isometric exercise basically here is the length should not change. Once the length is fixed, fix the length at there and then prescribe the exercises. So these three exercises I have shown just to say how beautifully the body weight is enough for any muscle to just work. So if you are having any complaints like, ma'am, I'm having neck pain today, I don't want to do any particular exercise, go sit in a wall set position and that is done. Your hamstrings, quads, adductors, abductors, even your glutes get activated there. So this is how exercise prescription is done using length tension relationship. Any questions? Thank you everyone.